The thing that drove me to choose cardiology first and foremost is the effect that it has on the patient. You know, when I was a kid, my grandmother had a heart attack, and the fact is that she would have died if it wasn't for the cardiologist. And seeing the amount of effect that that has on families and patients and being able to instantly impact their lives was really a strong motivating factor for me, let alone the fact that my own father has heart disease as well. The types of procedures that I perform involve anything that involves the heart. So I see patients in my office and do general cardiology and general disease, whether they be 18 years old or 102 years old. I also perform procedures in which I fix their heart. So if they have a blockage, I'm able to put in stents and help open up that blockage, or if they have a heart attack and open it up. I also can place pacemakers. And we're actually developing and growing an amputation prevention center to really help people with lower leg disease and blockages in their legs that a lot of people don't even realize they have. I have a lot of tips that I tell my patients, but you know, common sense is really one of the most important ones, in the sense that if you don't feel well, you need to tell somebody. You know, I have a belief that I always grew up with is treat everybody like your family. I had a gentleman who was from this town who had one leg which was probably 4 times the size of the other. He really wasn't able to walk, the leg was weeping, and basically he was debilitated. He couldn't even walk around his house. We were able to place a stent, open that up, get him the right treatment, and for years this patient had been told that nothing could be done. And so I'm a believer that, you know, there's always something we can do. And so this gentleman came back and he was crying to me about how much it impacted his life and his family's life, and that's what makes it all worth it.